Yes, welcome to the platform. We want to do general talks on cardiovascular diseases. It's a general talk. I will not continue with with the topic today. I don't know. Shindano kesho. Yes, we will not continue with the topic until on Tuesday because some of the people are in vacation and yes, the week has been of cardiovascular issues. Cardiovascular issues today. I've come late, but I think we have to do something before the day ends. So those will be on the chat. That's well, you can ask any question about the topics that we've been having and the programs that we've been going on with, and we see how we can help each other. And as people come in, you have so many questions. So many questions. I want you to post them. You post those questions here as I come. We're talking about the general talks of cardiovascular diseases. General talks of cardiovascular diseases. Now, we will have some talks. What do we mean by? We will have some topics that we will go through today, and these topics will be on. Okay, a minute, guys. I come. If you have any topic that you want us to talk about, you post it so that when I come back, we continue. But today we'll talk about generally about hypertensive diseases, coronary artery disease. We've been talking about stroke. The the topics about arrhythmias, heart rhythm problems is going on. We talked about heart failure, just giving an update, and we gave major risk factors and also medical conditions that can give you these problems. And also we talked about um, issues that you can modify and issues that are not modified. You see? So this is a week and a month of cardiovascular diseases and heart diseases. So it's better. Hey, King, welcome. I can see you there. I can see you there. I hope your Good Friday is going on well. Your Good Friday is going on well. There is warning signs to watch when you have heart diseases and complications. There are some warning signs you can watch when you have heart diseases and complications. So uh, the warning signs to check about, we will go through them, and there is a way you can prevent and how to protect your heart. Get it? There is a way you can prevent heart diseases and heart attacks. We will go through them. Today we are talking about general issues that we can do to help ourselves to avoid heart diseases. And then we have uh, harmful things that we can avoid and management of stress. We saw stress can give us irregular what? Heartbeats, which are called arrhythmias. Importance and early detection. And then we'll conclude and we see how we can move on with the problems that we have and protect ourselves from complications that are not. Greetings, Marjay, and everyone in the platform. Everyone is today. We are just talking about the general things that we really need to see when we have. We have been talking about heart complications, heart diseases for so long, and it's time now we just talk generally. As before we continue with the topics on Monday, it's Good Friday, and I know everyone everywhere is celebrating. Everyone everywhere is celebrating. So let's check this out. Let's talk about some factors that help us to live well. Some common things that we have been talking about the heart is infection and oxygen control. Yeah, a health, the health of your heart and blood vessels. These organs are responsible for pumping blood. You see, they are responsible for pumping blood, oxygen, and nutrients through the body. When they are not working well, what happens? It can lead to a serious condition that may cause disability or even that word that I don't like using. So Guys, if you are watching today, give me a like. I know you've been seeing me today from morning, very jovial, some other places. But now it's time to study. We have been having a good day. We have danced. We have done everything. And now it's time we. So if you are coming to the platform, let's do what? Let's like the video. Don't know if some other. Let me call Uncle if is online. There are some people tell me when you are online, please notify us. I don't know why YouTube does not notify them, or I've not reached the place of notifying people. So today, if you have a question that you've been thinking of to the public or even to anyone, you can post it here. Yes, Uncle? Oh, okay, okay. You can post it here so that we can know how to manage the condition. Yeah. There are so many people who have very different issues and things that they are undergoing in life. You get it? So these are the things that we really need to talk about today. Heart issues, heart complication, problems that you face. How have you taken care of a person who has been so sick? You get it? How have you been taking care of that person that has been so sick and so bad? Hmm? How have you taken care of the person who you are having with? Yes, Smile in the City, Dorothy K, Marjay, and King Ray. Sorry, today I've come late. You understand it's a Good Friday. Does heart disease causes bug under your ears? Bugs under your ears. Heart diseases, yes, they can cause bugs under your ears. And we will learn how they can cause bugs under your ears. You see, now there are so many things we need to talk about, and there you categorize these problems. You can categorize these problems like uh, the heart diseases that you were born with and heart diseases that you acquire as you live. Yes, Dorothy, come. Heart diseases that you acquire. Nani amekuja na mtoto? Si kuja tu na yeye, malizia tu au waende, then utakuja tu na examine, then uende. Yes, waambie wangoje kidogo. Okay. Now, those heart diseases that you acquire in life as a grown person, and those heart diseases that you live with as you grow. You get it? So, like Maje has asked a question here, like, does heart diseases cause bug under your eyes? It's a very important question. You see, you can have another condition that can cause bug under your eyes, and you can have a heart condition that can cause bug under your eyes. So we have to know that the pathophysiology of how that bug comes in so that you can differentiate. Greetings to everyone and everyone in the live stream. Uncle, today I've had several live streams from home, but I had to remove them because of copyright. I was really on top of myself, and I was dancing around, and so I had a camera girl and he was filming me everywhere I'm going. Yes, Dorothy, you're being told Good Friday, Dorothy, by Smile in the City. And Marjay B has asked a question. I'll answer it. So today, the most common cardiovascular diseases that you've seen us talking about always, the most common, you have seen us talking about hypertension, high blood pressure, hypertension, high blood pressure. Andrew, acha nilipe mfano sawa kidogo tu. Eh, high blood pressure. We have really talked about high blood pressure. You understand? These are problems that are brought, and you've noticed one thing about hypertension. Hypertension is brought by something in your system that is not working correctly, either the veins or the heart, or a disease that has brought the high blood pressure. So at times when you see someone has high blood pressure, start asking yourself, what is not working correctly? Yeah? What in this person's body is not working correctly? Is it the heart? Does this person have another problem? Does this person has another problem that is incurring in, that is coming in, that is not being treated? In their genetic makeup, do they have the factor of constricting veins? Because yesterday as we talked, we say your veins and arteries, they produce something called endothelins and nitric oxide. And endorphins, you remember them. And you should ask yourself, do we have those factors that are being endorphins that are being produced in your blood, sorry, I'm kind of like doing, but it's okay. Today is you to ask me questions. Teach me when you are at home and some things are happening, and those things are really, just a minute, my friend. 247. If you have not liked the forum, please, I ask you humbly to like this forum. Sometimes when someone is giving something that can be helpful, appreciation is good. 40. Appreciation is good because it makes even you who is appreciating feel better. You get it? It makes you who is appreciating to feel better. So today it's a general talk on cardiovascular issues. If you have not ever understood what hypertension is, if you have not ever understood, even if we have been learning and you have not understood anything about hypertension, because it is one, when you talk about issues concerning the heart and cardiovascular, the first thing that comes to your mind is, the first thing that comes to your mind is what? The first thing that comes to your mind is hypertension. You see, it is a chronic thing that, yes, coming, that has been happening. And friend, you'll give me some time, just few minutes. I talk to visitors here. Yeah. Someone is here. Yeah. I'll be banned sasa, atasimama pale. So guys, just few minutes, I deal with something, I'll be back. Baba, you have cough. What is wrong? Daddy took you to hospital. Daktari alidunga wapi? Alidunga mguu. Ukasikia pain? Huyo dokta bwana, hapana. And you are just hata ulilia. Ulikuwa concerned na hiyo cough.
Tena joto inakuja ikipotea.
Amekuletea sahi machungwa. He has a lot of sputum, and Gertrude are used to giving blood. Yes, it is there. This one, you can continue with it. Yes, the problem is they have not taken care now. This one is stopped, and you stop capsa. You don't want to see this drug ever again. In prednisolone. Prednisolone 40, what it does is, he's a boy. Another grown a prostate. This is a steroid. Hey, and then pair budoprutol. Pair steroids na anything. So these ones, we will put them aside. What we will do, Dorothy, ndio ametungwa, najua ametoa ceftriaxone kwa kweli. Sometimes it's not good to hizo ni hizi pale. I see.
Hizo ni test.
ziko hapo. Yes, I want to see the injections that amepewa.
Ziko hapa zote Flemings.
Okay. This is someone is asking me. Oh, just a minute, I'll be back. A minute, I'll be back. Nebulization, Fleming injection, and Fleming, the originals of the outbreak, refusing clavam injection. Umempea antibiotic kama mchanganyiko. This is wrong, eh? This is very wrong. Ona, wamempea clavam injection is amoxicillin, right? With amoxicillin with carbonic acid, sindio? That is a penicillin. And then they have given Fleming injection, the same class of drug. Naanda mtoto wako anasikia vizuri. But sasa siyo Fleming inatoka cephalosporin inatoka kwa penicillin. Kama huko. So this is wrong treatment. Nimeona nilikodi huyo pig mwenye ako on duty akakuwa rude. Nimepewa dexamethasone 4, atrovent na aspirin. Now we will stop all these drugs, because hizi drugs zote amepewa. The only thing tutampea ni ataendelea na hii, alafu utampea aspirin. Bring aspirin 5 ml. Only that. Anakof kwa sababu ya hizi dawa zote zenye. It's like the doctor who was treating hakuwa anajua the right antibiotic to use.
So nifanya test.
Yes, they can do tests, but the choice of drug is the doctor who is. Yes, sasa ukipewa antibiotic mbili zote ni same. Zote ni same, zinatoka ni same class, you understand? Nikupee yogurt na maziwa. Baba, today I'm not giving you an injection. Sasa. Yes. Nini?
Yo, kutoa hii. Almost immediate.
Because I wanted to monitor it first tomorrow. Do you know what? Ona tu dawa zenye amegundwa zote. Mpaka parafusi. Mpaka ametoa atropine. Before he give any drug, acha akae leo bila hizi dawa za kudungwa. I only give silene expectorant. Let your expectorant try to remove. If it will not remove, tomorrow tutakuja to expectorate na ya kuinject. If because the chest is not bad. The only problem is sputum imejaa. Iko tu hapa na hiyo ndio ina cause continuous. If they could give tuseme hii para Fleming injection na wampe kitu kama aminophilin. Unaona? Au mtoto angekuwa sahihi sana. But the mixture of all these drugs, this is all take.
Na nini na raise temperature sasa hivi?
Si kwa sababu if you give someone antibiotics like you know when you give antibiotics, the bacteria that is in the body inaanza kufight na una produce antibodies. So antibodies, white blood cells kuna lymphocytes type B ina producing antibodies. So zikianza kuproduce hizo antibodies zinaanza kukopi hizo bacteria. Na zikikopi bacteria zinaanza kufight mwili, joto
leo ameshinda hivyo
inashuka because of. So if you are giving 3 types of antibiotics, you are forcing the white blood cells, the lymphocytes, to do what? To produce more B lymphocytes. Ndio zikopi hizi antibiotics na zikopi pia bacteria zenye ziko. Kumbuka kwa hospitali ana get hospital acquired virus. Unapata hiyo ndio maana joto inaenda hivi. But leo oxygen iko sawa. No, this is very bad. Na mmekaa huko siku ngapi?
3. Nilimpeleka when I was passing here. Kini nikaona maybe ni usiku sana. Because nilifika tu nyumbani nikaambiwa huyu ni mgonjwa. Alikuwa amepewa switch ndio relax.
If you don't have bronchospasm, never give salbutamol. Unaona hiyo alimpea yeye ana spasms. Alikuwa daktari ni pediatrician kweli.
Ndio jina yake hapo.
Nilimcall. Niambiwa ni kuna nasa hapo alimpea namba yake. Anaongea. Nasikia na cough kama crook. Mpe sahihi atakunywa. Which kind of fruit should I take of it to reduce hypertension? Okay.
So hizi tuachane nazo.
Yes. Achana na hizo. You give this with ascorbate and then we so this one you put them aside.
No,
he is not asthmatic. Yes, he is. And then there are steroids. You don't want to deal with prostate issues at home. So kesho utamleta
sawa.
After hii utampea saa hii tena leo. No injections. So hiyo nini ilikuwa imekuwa reconstituted? Hiyo shika baba. Reconstitute nyumbani. But I don't want him to be given an antibiotic first. You don't give. Acha kae na hii kwanza. Ikifika saa 2:30 ya usiku, you will give 10 ml. And in the morning tomorrow you give 10 ml. Alafu mchana around saa 6 kesho 10 ml. So mimi nitamwona afternoon. Sawa. I'm very sure.
Ben bado alikuwa on Thursday, bado alikuwa mgonjwa tena. Kapelekwa some place hapo bypass usiku sana. Unaona ikusaidia.
The same.
Yeah, on Thursday last week. Sasa ndio Tuesday kutoka kazi. Kaambiwa asikii vizuri.
We wait first. Let me give an expectorant to try to talk. Syrup. The syrup won't work. Will come tomorrow and remove it. Physically.
So what time?
Around 2. Hiyo kikozi yenye hapo nao ndio ina cause, but ana nini? Ana spasms, kwa hivyo lungs ziko sawa. Ukiona kuna joto, uko na paracetamol, you give 15 ml or 50.
Your calpol.
Yes, calpol. Sawa. I don't see any bad thing. The only problem is they have given them very many drugs. Na hizo ndio zinafanya joto.
Wamechange sana hizo madawa.
It's not good.
Sawa. Asante.
Yes. A short break was that. So we continue. We were talking about what is called cardiovascular issues. I had to take care of that. That is a little boy. And you know, when it comes to children, you stop what you are doing and you take care of a good life that is young, because we don't want children to grow with complications. We want children to grow with immunity that is protected. So someone has asked, which kind of fruits should I take to reduce hypertension? Okay. What do you think about fruits and hypertension? What do you think about food and hypertension, especially when it comes to fruits? Yes. Ban and cheese today. You know, when it comes to hypertension, you have to reduce anything that brings cholesterol in your body. Anything that brings cholesterol in your body. So some fruits are having high cholesterol levels. Fructose. There are sugars that go to the bodies and they are changed into some cholesterol when the sugars are so high. So let's see some fruits that someone can use to reduce what we call hypertension. Foods, sometimes we call foods. You see, food like a banana, food like bananas, Bananas have are rich in potassium. Helps balance sodium and lower low blood pressure. When you take bananas and you get the potassium in your system, they lower sodium levels. And you remember when we said when you take high sodium foods, what does it do? Aldosterone and antidiuretic hormone wake up. Aldosterone is a hormone that retains sodium in your body. So when you take sodium, it retains the sodium in the vessel, so pressure goes up. But when you take bananas, they have potassium. Potassium helps your body to have to balance sodium, so that inside the blood system you cannot have high sodium content. You see, orange and citrus food. And these fruits that I'm saying, this is a question from Dorothy K. Dorothy, if you have acidity, you choose the kinds of foods that are that you are taking. You get it? So we check like orange and lemon, high vitamin C and flavonoids. Flavonoids in the oranges, they help improve blood vessels functionality. They help improve blood vessel functionality. We have watermelons. Watermelons contain sertraline. Sertraline will help relax your blood vessels, good for hydration and lowering blood pressure. These are fruits. You get it? These are fruits. You see how your questions are helping people? Like Dorothy K has asked, which kind of fruit should I take to reduce hypertension? And now they are coming out and we are trying to, to, con, to connect, and someone else is being helped. So we're sertraline from watermelon, it relaxes the blood vessels. You see, it relaxes the blood vessels and you feel well. There are also antioxidants. Antioxidants help in improving inflammation and improve heart condition. Eh? Pineapples helps in improving circulation. They contain something called bromelain. So bromelain is the content inside the pineapple that does what they reduce. Yes, we continue. They reduce what? They make your vessels relax and improve circulation to your body. So there are some other issues that we check out and we see. Like let's talk about apples. An apple a day does what? An apple a day makes you stay away from a doctor a day. Eh? Can we learn about an apple a day makes you stay away from a doctor a day? You see, let's see what apples produce so that we see. They have something called polyphenols, and polyphenols are what? They support overall cardiovascular health, but by relaxing polyphenols in your body. This is from the apples. They make your blood vessels relax. They make you feel better. They make you feel nice. It's an antioxidant. So the free radicals that are produced in your body, they are so true. I eat one every day. Uncle, and that's why I'm always admiring you. I've always admired you, your strength of walking around, everything in you. You see, because you eat. So now you can know that The apple you take every day. Yes, my sister, when I see you, I smile. I smile when I see Margaret in Norway. She's a charming lady, a good lady, a lady that makes everyone feel nice. So, Margaret in Norway, today we are talking general things about our hearts and everything that concerning the health. So, high in fiber and polyphenol. So when you're taking the apple, so if you are watching, please don't forget to give Dr. Ben a like. And remember, I've really entertained people today. Today was a good day. If you missed it, you can't rewatch because I was deleting because of copyrights. Okay, now we check on an apples. When you hear someone say an apple a day makes you stay away from a doctor, it means it contains fibers and something called polyphenols. So the polyphenols, what they do, they help support overall cardiovascular health, overall, relaxing the veins, clearing the oxidants in your blood, the fatty plaques that we talked about that are coming in your system, they clear them, so you don't have arteriosclerosis, hard veins and arteries. You have veins that are nice. And then we talked about avocado. I know someone knows that song that sings about avocados. Jamaicans in the house. Tell them, Jamaicans in the house. I have a little juvenile Orlando. Jamaican, someone told me I might have blood from Jamaica. I find out if my forefather, my father, or my mother comes from Jamaica. Go and listen to Janine with the song Avocado. And what does avocado give you? What does avocado give you? It gives you potassium and healthy fats. Potassium and healthy fats. What are these healthy fats that it gives you? High density lipoprotein, the ones that help to clear the bad one, which is called low density lipoprotein. Avocado. Avocado. You see that? They are good. Smile in the city, giving you that picture. The avocado itself. Yes. Grapes, especially red and purple one. They contain something called resveratrol. Good for blood vessels. They make the blood vessels to contract and come well, to constrict and come well. Please, this is a question from one of us called Dorothy K. So Dorothy is asking, what kind of fruit should I take to eat to reduce hypertension? Yes, now you know the fruits that you are eating. There are so many fruits, but let me give you the last one that works like the banana itself. The last one that works like the banana, rich in fiber and potassium, is called pears. Pears is a sister to the apple. If you have ever seen a pear, say yes. Pears is a sister to the apple. The important thing in life about hypertension, after the fruits, my fellow friends, everyone, nowadays I call Jamaican uncle my family. You get it, because he's like family. My friend and family, and my sister around, who is Margaret in Norway. Reduce salt intake. Don't tell always aldosterone from your brain to do what? To be waking up. When you are taking a lot of salt, the hormone, the gland, the hormone that comes out, aldosterone, it tells your blood to retain salt. And you see, water goes where salt is. So if salt goes where salt is, what happens? You have a hypertension, retained fluids inside. Another thing, don't just be there. Dance like me at times. Make you do aerobics in your home. Do aerobics. Walk like our sister Mercy. I saw her walking to the what is called the way of the cross. The way of the cross. Walk, my friend. Exercise. We don't want people to rely on drugs. No, we want people to live healthy without taking drugs. Mercy is here. I was watching you as I'm dancing at home. Well, you went to the way of the cross. Or is it? I think it is called the way of the cross. Maybe, yes. Take adequate water. Barbara's world. I miss Barbara's lives. Barbara, I miss your lives. Please send me your links when you are going live. I miss your lives. Today I was having lives from morning. Some of the lives I was deleting them. You know why I was deleting them. Now you take water, adequate water. Take some water. I'm just explaining how. And when you're coming in, remember there is that like Katham, and then you share the video. Let the people know that here we discuss matters health. Yes, and we discuss while we are smiling and laughing and sharing some things to make people feel we are family. You see that? Nice one, very nice. Sometimes when I'm talking and sharing things at Mercy, you are going to you are going to live long because just call your name. Jamaican uncle. Love always. Now, you see, sometimes when I'm helping and telling people how to live a healthy life, I feel inside well. I feel relieved. I feel my head is nice because I'm helping a life. Now, Dorothy K, you've had all those fruits that you can take, to make yourself don't have hypertension. Yes. So like I'm seeing we are growing in numbers. Please and tell someone to come and watch so that we get a good community, a bigger. So we continue in with with another talk. We have something called coronary artery disease. Block of vessels supplying the heart. Blockage of vessels that supplying the heart. We have seen exercises help. The other thing that we talked about is sore throats to children and grown up. Now you know that sore throats are just not a Passover. Some people get sore throats and they say, this is just a flu. I will go to the over the counter, I get some medicine, and then I'm okay. My friend, you saw where your rheumatism comes from. Now you understand. Persistent fevers with sore throat, please check the doctor out, get proper medication. We don't want people to have rheumatism and rheumatic heart disease. Okay, let's go to stroke. I'm going through some things that can make you have the conditions that we talked. It's a general talk. I'm just giving an overview of the problems that we talked about. Remember coronary arterial disease, stroke. We talked about stroke yesterday. And I was explaining about these veins, carotid artery, coronary artery. You remember carotid artery, coronary artery. We really talked about them, and we came to see how we can stop strokes. It is called cerebrovascular accident. Cerebrovascular. Vascular, it means the veins. Cerebral, it means the brain. So when I'm talking about cerebrovascular, Miriam, I'm here. Miriam Mumbwa. Sometimes I just watch Miriam. He's a calm lady. He doesn't talk so fast. He doesn't talk much. But when she talks a very big point. So when I get to Miriam Mumbwa's live, even if I've not commented, I just watch. I feel relaxed. So, guys, if you are new, please follow Miriam Mumbwa, our calm lady. Miriam, today was a good day. Eh? You are telling me I'll get a strike. But you are enjoying the moves. welcome, Miriam Mumbwa. Thank you so much to be here. Thank you so much to be here. Sometimes when I'm at home, because I'm also human. I'm also human and I'm a doctor. I get home and I forget I'm a doctor so that the family and everyone can feel I'm home. Yes, you get. But sometimes when you carry your profession at home, my friend, your life will be so boring. I don't do that. I don't carry my profession at home because at home I am hey Margaret, my sister, because at home I'm someone else. You see, I have to take care of the responsibility of a man at home. You get? So when I'm at work, then I'm at work. Now I'm a doctor. Yes, like, and we go on. We have talked about common cardiovascular diseases like hypertension, coronary artery disease, and Dorothy K asked about a fruit she can take so that she can reduce hypertension. We have talked about apples, all those, and I've explained what they have. And Dorothy has felt nice now. She knows how to eat them. But don't eat fruits that have acidity when you have acid problems. Yes, we talked about arrhythmias, abnormal heart diseases, and heart failure. Now, guys, I'm kind of like not going so fast on diagnosis and management because when it comes to heart failures and cerebroarterial management, I will be uploading videos because those ones are for doctors, and the doctors, most of the people that will be watching the videos are students that are medical students. So don't feel bad when I'm going slow on management. It will come. When you're coming in, please, and you have not liked, give me that thumb. So arrhythmias, we talked about them. We talked about arrhythmias, the abnormal heart sound. We talked about that. And you saw when you get something called focal atrial flutter, it can give you a clot. Fibrillations, heart beating in a bad way, and it's giving you fibrillation. You saw it can give you a clot. Now, we don't want things that can give us clots, right? We don't. So we need to take care of yourself. The last one that I want to say here is one thing. Please, let's know how to cope in life, because what brings stress can give people. Hello, Mercy Grace. Good to see you too. Yes, Mercy Grace. Barbara says, good to see you too. You see, I'm talking about mental relief. We are a community online. Some of us have never met, but when I've not talked to Barbara, I've not seen Barbara for some time, I feel something is wrong. Imagine if I've not talked to Uncle or texted Uncle for some time, I feel no, something is not right. When you go online and you don't see Margaret in Norway online, you feel something is not right. So mental health with the social community is important. Don't be someone who stays alone. We have a very big community online that when you interact with some people, you feel relieved. Sometimes your friends can let you down and then you get into depression, stress. Get solemn when where you can. You see, online here we've got a community, and this community is really helping us to cope with some issues. I'm very sure when I started this, when Jamaican Uncle was pushing me to start these talks, I'm very sure one or two people have helped with that talking. You get it? So hypertension is something that you can manage when your mental health is okay. Know how to say it is okay, let me do plan B. Know how to relieve your pressures. Don't hold to things that will give you always problems. You get it? Don't. If let me say you were at the position you are right now, you are not born in that position, you are born someone else, what will happen? The only thing in life that we really need to know is know how to handle situations and know how to say it is okay. Don't bring pressures to your brain. No, don't. If you are having a one bedroom house, if you are living in a big house, if you are living where the situation as it is, the current situation as it is, know how to handle it as it is. Yes. Now, let me go to something called the risk factors. The risk factors. What are the risk factors? These diseases are often caused or worsened by these diseases, cardiovascular diseases that we have talked about. We have talked about stroke, heart failure, arrhythmias, coronary artery disease, and hypertension, and many that we have been talking about. These diseases are brought by several things in life. Unhealthy diet. When you come to Kenya, in Kenya, when it is an occasion, we know how to roast meat and ugali. Sometimes we even eat meat without the starch itself. And the kind of food salt we put in that meat, hey. Eh? A lot of sugary things, fats. Let me give you something funny. You see, when you take things that are deep fried for some time, you'll have stomach issues. Be sure. When you take things that are deep fried for so long, you will have stomach issues. Why? Because the more you burn fat, the more it produces some things that are called free radicals. And free radicals can bring what? Several bad things. The fats that you burn always, people they cook French fries at home and they recycle the fats. As the fats burn, as the fats burn, they produce something called free radicals. Free radicals are the ones that give you cancer cells. If you have something in a factor in your family called, of cancer, and you always burn fat, you deep fry French fries, chips, here in Kenya we call them chips, you know what will happen? After some time, you'll start developing cell damages. They attack cell membrane protein and DNA of the protein. So you will start getting, that's why it is very important to reduce your intake of fried things, because if you're buying them from a shop or somewhere else, you don't know if you don't know the fats that were used, if were recycled or what. These things that we deep fried deep frying every time, producing free radicals from the fat, they make you age faster. They make you age faster. The fats burned producing free radicals, they accelerate skin aging, wrinkles, loss of elasticity because glutamate is depleted, and dull skin. You look at someone like this, the skin, someone who is 28 years, you look 28, 27, you say, no, this person should be 40 years. And this person is not 40 years. You are used to junk foods that are deep fried. Those deep fried foods, they produce something called free radicals. Cancer development, cancer, mutations that can lead to lung cancer and colon cancer because you don't like fiber. You see, cardiovascular diseases, what we are talking about, atherosclerosis, free radicals. So I'm not taking you not to eat French fries. I'm telling you, if you have that tongue that loves sweet things and French fries, and you see, you reduce, because atherosclerosis will cause stroke, cerebrovascular accident, neurodegenerative diseases like Alzheimer's disease and Parkinson's, free radicals from deep fried foods. The more you recycle the my friends, you see now. Someone asked me one day about free radical, about what causes Alzheimer's disease. Go look at my playlist of mental health. You will see these things. Neurodegenerative disorders, mostly if you are not born with them. Neurodegenerative disorders I'm talking about issues like Alzheimer's and Parkinson's. Forgetfulness every time. Yes. Doctor, thank you, but I have to leave now. It's okay. It's okay. You will rewatch Smile in the City. I'm just about to go. I like 30 minutes, then I'll be out. You can rewatch. Bye. See you. But remember to share the story. Inflammation triggers chronic inflammation, worsens many diseases. It makes your immunity system weak. And if you are diabetic, contribute to diabetes type 2, because deep fried foods they produce free radicals, and the free radicals, they damage the nerves and the kidneys. Don't ask me why our grandfathers were living for long. Now you know boiled food, they used to boil food, they used to roast food without salt and eat it like that. Now you know why. We like sweet things that are giving our life headaches. Eye diseases, cataracts, and loss of visions. You see, free radicals. Someone asked me, why is it that cancer is so severe and persistent nowadays? Free radicals. And what are free radicals? What are free? Hmm? What are free radicals? Because someone may ask me, what are free radicals? Please, now you know the answer to the escalating cancer nowadays, escalating heart diseases. Now you know. And what are free radicals? What I will say about free radicals is, I may say they are like a molecule in trouble. It's missing an electron, so it tries to steal electrons from other cells. This damages the cell. This one I'll explain to it. I'll try to explain about it so that you understand, because free radicals are the main causes of cancer and very bad things to people in the world. Now, please carefully listen to this story about how people get cancer. How people get some cancer from free radicals. Now, am I being seen? No. Now, I want you to look at this. I want to explain something very important. You have deep fried your French fries so well. Now, let's say this is the structure. No, let me write it well. Let's say this is the structure of fats. This is just a general explanation of what a free radical is. Now, when you are deep frying, you are burning this fat at a high heat. So it makes this fat to do what? To dissociate. And then you get a structure that is like this. 3, without an electron. These are electrons. So this electron is in your food that you've one electron that has comes out with the French fry or the food that you've taken. It is attached to this food. And you know, for anything, any electron that is in your body, it should be attached where it deserves or go to where it deserves. So you have eaten French fry that has a free radical, free electron. Then, because it moves from the, because of the high burning and recycling, so your cell is here. You have eaten. Then this French fry, it comes, it releases. So the electron has gone to the cell, and now it has done it attaches itself to your DNA. If the sequence is G, G, C, C, uracil, uracil of your DNA, what will happen is these free radicals that came from burning oil will come and take this and it will come here. So it will not be the same sequence. So this cell that has been dissociated and the free radical are dissociated, instead of doing its job, it'll start to do something else that is not its job, because the sequence of copying of the DNA has changed. That's why I'm saying free radicals are like a molecule in trouble. It's a missing electron. You get it? It steals electrons from another person so that it can live. And then the DNA starts doing something else. You start having, when you change your DNA, what your DNA configuration, that is where we start having cancers and mutations. Mutations that your cells are not doing things that they should be doing. So from today, if you are aging, don't take fried food every time, a lot of fried foods. Just take boiled foods, and then we live well. Hmm? And what are the places that you can get free radicals? Certain chemicals, radiations, smoking, pollutions. You get it? Hmm? This is where you can get some free radicals. So we have talked about the free radicals and how you can get the free radicals. So unhealthy diet, the risk factors, lack of physical activities. You don't want to walk every time you are having your car, and every time you even going to the market and it's just a mile ago, you want to go with an Uber. In the evening after work, you want to go and visit to hang out with your friends, and they are smoking and they are taking alcohol. Stress, I've talked about stress. Stress is a major thing when it comes to hypertension, and we talked about it. So when you hear, let's say about some warning signs that you can hear, and then you find that you have maybe you have started having cardiovascular diseases like hypertension, chest pain. That's a major thing, especially central chest pain. What kind of food can we eat to help destroy that? Okay, antioxidants. That one I'll say antioxidants. Let me go to, or let me deal with the kind of foods that we can take before I go to before I go to before I go to warning signs. Yes, let me deal with that question, because before I go to warning signs, what's happening here? Yes. Some foods, let me deal with that question first so that we continue. Fruits are antioxidants. Most of the fruits that are like the ones that have vitamin C, they are antioxidants, and they really help a lot when it comes to removing free oxygen. That's why they are called antioxidants. Berries, oranges, mangoes, pawpaws, and avocados, name them. They help protect cells from boosting immunity. They bind into the free radicals and they remove. especially dark green colored ones, vegetables. Dark green like sukuma wiki, broccoli, carrots, tomatoes, and spinach. These ones, they are vitamins. They contain vitamin A, C, and E. And remember, carrot contains beta carotene. It really helps when it comes to removing the free radicals. We have nuts and seeds. Nuts and seeds. Nuts and seeds like groundnuts, almond, sunflower seeds, and flax seeds. They really help. Rich in vitamin E. Protects the cell membrane. Protects the cell membrane from getting this electron that is coming from the free radicals. And then you eat whole grains, oats, brown rice, and whole maize. Do not remove when you are eating corn. Do not remove the husk because it helps us fiber. Green tea, yeah, fruits, fresh fruits juice, very important. Fish and use olive oil. Fish like sardines, they have omega-3. Herbs and spices, you see, ginger, turmeric, and garlic, we always use them. They are antioxidants and anti-inflammatory. They help even remove the free radicals. Free radicals, you have to reduce fried foods, processed foods, excess sugars, and smoking and alcohol. That is the main importance that you can. See, Jamaican uncle, I think I've really answered that correctly. Now we go to warning signs. Warning signs. What are the warning signs that you can see so that you can know this is a problem? Chest pain and tightness. Chest pain and tightness. Shortness of breath. Severe headache and dizziness. Weakness of one side of the body always says that this person is getting stroke. Palpitations, heart palpitations, feeling abnormal heartbeats. So we have talked about how to prevent health lifestyle, eat more fruits, vegetables, and whole grains, reduce salt intake and foods, drink plenty of water. Have at least 30 minutes of exercise, even 1 hour of jogging and walking around and cycling. It's very important. And avoid harmful things that we have talked about. We have talked about stop smoking, limit your alcohol intake. I'm a bit busy watching in the bush. My sister, what are you doing in the bush? You went for camping. Relaxation techniques, taking your mental health at par, very important. Regular blood check, BP, blood sugar and cholesterol. At least a year of general checkup of blood works is important. Now, importance early detection. What when you do a year blood work, important early detection. What it does, it prevents complication, reduces treatment costs because the more you are damaged, the more you get the problem, and it saves lives. So today we have talked about general things and you've really given me some good points. It's Good Friday and I know some people have their friends and relatives around. So ask me like 4 or 5 questions before I leave. I've given you some general topics that we can handle. So anyone who has any topic we can work on, please. Anyone who has a topic or a question? Anyone? Anyone who has a question before I log off, you can ask. Okay, I see today we are okay. No many questions. Enjoy your Good Friday with your family and everyone. I thank everyone who has come online to support me. And please, guys, Thanks, Uncle. Share my channel everywhere. Share channels of my friends here so that we can grow together. Have a lovely day, and may God bless everyone. Bye. See you.